So first, could you please introduce yourself? Who are you, what's your name, your position, where do you work at?
So my name's Tom Poles. I am a professor of oncology at Bart's Cancer Centre in London.
And so how many times did you attend the Focus event?
So I've attended the Focus event on 3 occasions. I've been to sunny Toulouse 3 times.
Great. And why do you decide to come every year?
I decided to come this year because I'm lucky enough to be invited. That's the first important issue. I love the people here. I think the French collaborative academic work is amazing and I love to be part of that environment. I like the structure of the meeting. I like the interactive nature of the sessions. I'm lucky because everyone speaks English and my French is awful. Yeah, it's a combination of the people, the meeting and the location, which is why I think it's fabulous.
Great. And how would you qualify the Congress in one word?
Fabulous.
Cool. What is so special about the Focus meeting if you compare it to other meetings you can have in onco-urology?
I think the Focus meeting is quite intimate. I think it's quite focused, hence the name Focus. I think it's quite focused on key topics. It tends not to be an exhaustive list of the same discussions again. It focuses on the most relevant issues of the time. So this year's agenda is very different from last year's agenda. So I guess focus is probably the right word. If you were to describe a word if you were going to give a word to describe the meeting, perhaps rather than fabulous, it would be focused, or fabulous and focused. Three words. Very
good. You have a speech this year.
Yes.
Yes. What is your speech about?
I was lucky enough to be talking about the combination of enfortumab vedotin and pembrolizumab in urothelial cancer. I think it's important because it's now become the standard of care in Europe. It's also true that people in France have just started to use it, and that's really lucky. We're not there yet in the UK. The key to the combination is it looks more active than all of the combinations we've used in the past, particularly platinum-based chemotherapy, across broad subgroups of patients. It heralds a new dawn, and the things we talked about was issues around the efficacy, whether there's a degree of patient selection required, the toxicity of the drug. We talked about the Nectin-4 biomarker. We talked about other series, monotherapy data for the drug. We also talked about the future. And that's one of the other things I like about this meeting is we're not confined just to talk about where we are today, but we talk about the future too. And we talked about what urothelial cancer looks like in the future, the role of ADCs in immune therapy, particularly the role of enfortumab vedotin and pembrolizumab, because I think it's not just going to transform advanced disease, but I think it's got a really good chance of transforming muscle-invasive disease in the future too. And we chatted about that. We chatted about the role of surgery, and I think the conclusion is, as this change occurs, education and training about how best to give the combination, number one, and secondly, about how we're going to develop the future with the combination is a really exciting topic.
Great. Today's topic is optimization of treatment. About your speech, what would you like the audience to remember in terms of optimizing treatment?
If I'm lucky enough for the audience to remember anything that I said, which is not always the case, if they did remember anything, I would like them to remember 2 things. Firstly, I think that this regime is more active than regimes that have gone before it. And so I think this is a big change in urothelial cancer. And I think it's largely for unselected patients. There are some contraindications of drugs, immune active diseases or significant peripheral neuropathy, but overall, it's a big change in urothelial cancer. That's the first thing. And the second bit is we need to learn from each other how best to give this combination. There's a skill to give it. I don't think it's more toxic than platinum-based chemotherapy. I think actually overall it's probably easier to give, but the toxicity is different. And we need to learn from each other about the best way of doing that. And that actually is why I'm here.
The other aspect of this year is the connection between France and Canada.
Yes.
As far as I know, you're neither French or Canadian.
No, I don't think I have any genes.
And what do you think about this connection between France and Canada? What do you think about their differences, maybe?
Well, I'm aware that France and Canada are separated by a big ocean, but partially connected by a very strong and beautiful language. Montreal is a city that reminds me of a French city, and Quebec too. I've been to those areas. And culturally, I see there are many parallels. And I know that the French are very proud of their connection with Canada, and I'm also aware the Canadians are extremely proud of their connection with France.
And in terms of oncourology, you think there is a cultural difference, a different approach, a different way of thinking, of working, of curing between France and Canada?
I think both France and Canada have, actually in some respects, similar academic aspirations in terms of their investigator-initiated work, both brilliant, by the way, number one. I think they have, to some extent, similar healthcare systems. I think inevitably Canada's probably slightly more influenced by the United States and France slightly more influenced by Europe, but both countries are passionately independent. And I have to say, of my top 10 countries in the world, both France and Canada would appear very close to the top of that list.
Okay, so thanks for the spontaneous part. It was perfect. Thank you very much. And now my colleague, director, would like you to be an actor and say a few lines for us. So basically in French, it's a pleasure to come every year at Focus.
Yes.
You can say it in English for sure.
Yes.
So I would just say you can be, it can be your own words, but the
yes.
point
it's
is,
a pleasure to come every year.
To me, it's a very it's a must go event. I don't know, something. The fact that it's very important.
If it's okay for you.
Of course, of course. It's a pleasure to come here every year, and if I'm lucky enough to be invited, I would come every year.
C'est ça? Ouais, parfait. Ok. On y va? Bien. Je vais plus okay, shall we go?
Yes.
So the same sentence. So it's a pleasure.
Yeah. It's a pleasure to be here and to come to this focus meeting in Toulouse every year. If I'm lucky enough to be invited, I would indeed come every year.
Parfait. Bravo. Merci beaucoup.
Thank you very much indeed.